The Center for Disease Control and Prevention's 2015 Youth High-Risk Behavior Survey revealed that almost 26% of Latina teens nationwide contemplate suicide, and sadly, almost 1 out of every 6 attempts. Organizations like the Young Latina Suicide Prevention Program, Life is Precious, try to reach these women before it's too late. And here to tell us more is Communal Life founder, Dr. Rosa Gil, and we thank you so much for sharing with us.
Thank you so much.
We were talking a little bit in the break about this, and so every 2 years, these numbers come out by the CDC.
Correct.
And then when we look, we're finding that here, Latinas are increasing in the number of suicides.
Yes, it's alarming to see the difference between 2013 data and the data of 2015. For example, Latina adolescents in high school seriously thinking about suicide is 18%. That is very high.
Mm-hmm.
When we look at the attempts, it's even more worrisome because it's 15% of Latina adolescents who are in high school in the Bronx are not only thinking about killing themselves, but they're really doing something to kill themselves. It's an attempt. And this is very worrisome statistics. It's really sad.
And when you look at these numbers, obviously we see the numbers rising. The next immediate question is going to be why? Why are we seeing these numbers rise?
We're seeing these numbers rise because, the factors that contribute to this problem has to do with the fact that these adolescents, their family came from other countries. There are differences of how do you accept behaviors from adolescents that are acceptable in, let's say, Dominican Republic or other countries. When the girls get here, their mother said, well, no, I don't want you to go out with your boyfriend after 7 o'clock. Mm-hmm. And however, here is a little bit more acceptable to do that. So there is a clash because the old culture versus the new culture of the adolescents. That's the first things that come to mind. There is a conflict in the family, and researchers have demonstrated that. But the other the most significant data has to do with the fact that many of these adolescents are living in families which are experiencing poverty. And poverty is a tremendous stress on our emotional being. So, the girls who are having already challenges because there are different levels of acculturation, now they're experiencing the challenge and the stress of poverty. Plus, then you have the issues in the school system in New York City, particularly in the Bronx, where you have a lot of girls experiencing a lot of challenges by their peers. They're making fun of them. They're not really kind to these girls. Mm-hmm. And the school system who also doesn't provide sufficient support for these adolescents.
Well, Dr. Gill, let's talk about what you're doing, because obviously you recognize there's a need, you recognize there's a problem. How are you trying to deal with this?
Well, what we have created is a program called Life is Precious, which is here in the Bronx since 2008. And we provide services to these girls after school. It's voluntarily. They must have a psychiatric diagnosis, of course. They must be attending a clinic, but we provide a safe place for them to talk about their challenges in life. And they come to the program around 3:30, 4 o'clock. They are with us from Monday through Friday up to 7 o'clock, 7:30. And then on Saturdays we have Family Day, which the girls come in with their families to talk about the challenges that they're experiencing between 10 o'clock in the morning and 2 o'clock in the afternoon. I am very pleased to say that none of the girls who have been attending this program have completed suicide, thanks God. So that means that this program is working, and we have researchers from Columbia University that indicate that whenever one of these girls is in the program, Life is Precious, for 1 month, you begin to see the reduction of suicide ideations and suicide behaviors. Mm-hmm.
What are the things that you're conveying? Because obviously there's a mindset change. If a person wants to commit suicide, right, obviously you're at the brink of something.
Right.
And you meet them at that brink and pull them back. What are you doing?
What we do then, we provide them with Creative art therapy, for example, is extremely helpful because it provides them the opportunity to talk about the issues that are really troublesome. They write poetry, they do beautiful painting, they use music, they write songs, so they're able to express all these feelings that are bottom up, that are really making them feel like they don't want to live any longer. So the interventions that we do is to help these adolescents to really express their feelings. And of course, what we also do is to have their family giving support to their daughters.
So for somebody who's out there watching right now, say for instance you're watching and you have a young person out there, what are some of the warning signs that we need to be watching for somebody who wants to come?
Parents need to be aware of any changes in behavior. For example, one of the most significant things that we can observe is change in the patterns of sleeping patterns. A girl that used to, sleep 8-9 hours, now she doesn't want to get out of bed. She is always talking about being tired. So there's changes in the behavior, sleeping habits. There's changes in the behavior of eating. A girl that before used to like to eat, now you have a hard time for her to eat something. That should be giving the parents a sign off. Then when the girls doesn't want to go out anymore to be with their friends, when she used to love to be out, then that's telling the parents there is something happening here that I need to pay attention to.
Or even talking on the phone, perhaps.
That's right, absolutely. Or, the girls who before wanted to be on the phone all the time, now doesn't want to talk to anybody. So it's a withdrawal. The girls doesn't want to be outside, doesn't want to go to school. So those are significant behaviors that we need to watch for.
Let me throw this out here. We've had this conversation in other circles where it comes to counseling. It seems as though in communities of color, counseling is not well received. It's almost perceived with the stereotype that you're crazy. But in other communities, counseling, therapy is just a normal part of everyday life.
Absolutely, because I think in the Latino community, there's a stigma associated not only with suicide, but depression because of the connection with mental illness. And I think that we need to help our community to understand that, sometimes one day you don't feel good about what's going on, which is fine. But if it continues to be like that, you're feeling depressed every day, then there's something that needs to be treated, like physical illness. If you have diabetes, if you have asthma, there's treatment for it. So feeling depressed, feeling with not wanting to live any longer, we need to accept that that's part of our life and that we need to get treatment for counseling, like you're saying.
Yeah, and I think that sometimes just the understanding of what it is,
That's right,
can make all the difference in the world.
That's right. And that we are not, because we have these mental health issues, doesn't mean that you are a loco or crazy.
Right.
That this is just part of the challenges that we have in life.
You're helping some people. I want you to know you're helping some, because a lot of times people don't know, and they feel a stereotype, and because of stereotypes, now they take matters in their own hands, and then they end up committing suicide.
That's right, which is very sad.
Yeah. So for the girls who are part of the program, if there's a person that wants to become a part of the program, is hearing this and has been struggling, what do they do?
They should reach out to a professional person. They can call us at Community Life, at Life is Precious. They also need to talk to their parents, their families, and to talk about what is troublesome to them. But we will welcome adolescents reaching out to us, as well as the parents.
Latina teen suicide is a rate that is continuing to rise, and Dr. Gil and her staff are working very hard to try to combat those numbers. And as we said, the CDC has released a report every 2 years, and the latest numbers show Latina teens taking a rise. And so before we used to be able to contribute it to the economy and depression and things like that, but now it's just life challenges.
Factors.
Right. Okay, well, Dr. Gil, thank you so much for coming and sharing with us, and certainly we'll continue to get more information out there for people, and hopefully as the numbers continue to go down, you'll be able to come back and tell us why they went down. All right, Dr. Gil. All righty, well, guess what? We're going to take a break, and we'll be back with more right after this.